As an ER nurse, have you ever taken care of someone who was alert and responsive, but their lab work or imaging told a far different story as to how seriously ill they really were? This cheerful girl named Samantha walked into our ER on a Tuesday night, clutching her stomach and actually laughing. She was maybe 26, wearing yoga pants and a college sweatshirt, looking like she'd just come from the gym. She told our triage nurse she had just a little gas, and kept giggling about how her boyfriend dared her to come in because she wouldn't stop burping. She was cracking jokes, scrolling through her phone, completely normal. Her vitals were slightly elevated, but nothing crazy. Blood pressure a bit high, heart rate around 90. I almost marked her as non-urgent and sent her to the waiting room, but something bugged me. When she got off the gurney to use the bathroom, she winced for just a second. It was tiny, but I caught it. She covered it up immediately and went back to joking around. That little wince saved her life. I convinced the doctor to order labs and a CT scan just to rule out appendicitis. Samantha thought it was hilarious. She kept saying her boyfriend would never let her live this down, spending $200 on emergency room gas. She was texting him updates and taking selfies in the hospital gown. The labs came back first. Her white count was through the roof, lactate elevated, but she was still laughing at TikTok videos on her phone. Then the CT results popped up on my screen. I had to read it 3 times because it didn't match what I was seeing. Massive mesenteric thrombosis. A blood clot had completely blocked the arteries feeding half her small intestine. According to the imaging, she was already in early ischemia. Her bowel was literally dying inside her body, and she had no idea. The ER doctor nearly choked when he saw the scan. This condition kills people fast. Usually patients are screaming in agony, vomiting, doubled over. But Samantha was sitting up in bed, asking if she could order pizza because all this gas talk made her hungry. We had to move fast. The doctor explained she needed emergency surgery immediately. I watched her face change as reality hit. Her smile disappeared. She asked if she could call her mom first. Then she started crying, not from pain, but from fear. She told me she hadn't talked to her mom in over a year after some stupid fight about her boyfriend. She was scared she might die without making things right. I helped her dial while the surgical team prepped the OR. Her mom didn't answer. I left a voicemail for her. I said her daughter was having emergency surgery and wanted her to know she loved her. Samantha squeezed my hand so tight it hurt. They wheeled her back 30 minutes later. She was still alert, still talking, asking if she'd be okay. The surgeon told me later that if we'd waited even 2 more hours, she would have been dead. They had to remove 3 feet of dead intestine. Samantha spent 2 weeks in the ICU. I checked on her every shift until she was stable. When she finally went home, she was missing half her small intestine and facing months of recovery. She never joked about stomach pain again. 3 weeks after she was discharged, her mom walked into our ER, not as a patient, but to find me. She'd driven 4 hours to thank me for that voicemail. She said she'd listened to it 20 times and cried every single time. She and Samantha were talking again, slowly rebuilding what they'd lost.